Hi, thank you so much for attending our presentation. We're going to present on nutritional science and dietetics, our program, the assessment and improvement plan specifically. So I am Dr. Neal Malik, and I'm an assistant professor within the Department of Health Science and Human Ecology here at CSUSB. And I am joined by Dr. Dorothy Chen Maynard, who is a professor within the same department here at CSUSB. So we'll begin with our presentation aims to give an overview of what we hope to accomplish here. So first, why are we bothering with an assessment to implement and improve the nutritional science and dietetics program? We're going to discuss why this is happening, what's the purpose, as well as who's involved and what's the actual plan. How are we going to assess and improve our program?
So why bother, and what is the ultimate goals of using the assessment tool as a way to provide program success for the students to complete our courses and to become a registered dietitian or a registered dietitian nutritionist? The graduates need to complete several steps prior to becoming a registered dietitian. And one is that they have to complete a bachelor degree and complete the courses that are in the curriculum. And then the second step is they have to complete 1,200 hours of post-baccalaureate internship or supervised practice program. And then in the accredited program. And then the third part is that they need to take the registration exam to become an RD. So the accreditation requires that both the didactic program and the internship program complete a self-study report and a site visit using a set of goals to be met on the standards set by the Ascend. And so our program is accredited as the didactic program by the Accrediting Council for Nutrition and Dietetics, or known as Ascend. This body also set the standards that each program, as a didactic program or as a supervised practice program, need to complete. And one of the criteria is that the graduates of the program must complete the registration exam successfully within 1 year of their completion of the internship program. And so this exam is administered by the Commission for the Dietetic Registration, or CDR, lots of acronym, using the computer-based variable length exam. And the exam is usually about 120 questions, with about 25 questions that are what they call a test exam. And so exam questions that to be used for future tests. So what is the ultimate goal? The standards of the Ascend requires that we pass our graduates pass the exam with a benchmark of 80% of all the graduates who take the exam within the first year must pass the registration exam. And so right now our exam passage rate is at 75%. So we need to come up with a plan for us to improve our exam passage rate. And so the program has been working within the group of the program faculty to come up with a plan to improve that exam passage rate so that 80% of our graduates who take the exam will successfully pass the registration exam. And so we need to develop a program improvement plan for the exam passage rate, and they're submitted to Ascend by March of 2022.
So who's involved with this plan? How are we going to make this happen? So basically, we incorporated leadership at all levels. We have the Dean and Associate Dean of the College of Natural Sciences involved in overseeing this improvement plan, along with the Department Chair of Health Sciences. We have our nutrition science and dietetic program coordinator, the didactic program and dietetics director, the supervised practice coordinator, all involved, as well as the nutrition program faculty. So everyone at all levels are involved in this program, this improvement plan, I should say. We keep talking about this plan. What is it? So let's get right to it. We initially started with meetings with leadership at all the levels I just described, along with the program faculty. We discussed possible causes for the drop in exam passage rates. We brainstormed with faculty, not only within our institution and within the program, but at other institutions, as well as practicing dietitians to discuss a program exam pass rate improvement plan. What are their thoughts? What are their experiences? And pulling those in. Ideas were then presented to the group and proposed actions were assigned to each member. And that's what we're going to share with you on the next slide. So this is just a portion, a screenshot of just a portion of a document that's tracking our assessment plan. So you can see proposed actions on the far left. We see which are still under discussion, which will not be implemented, which will be, which have already been implemented, actions, very specific, clear actions that will be taken, along with dates the actions will be completed, by whom, meaning the responsible person, and the earliest date we expect this to impact the actual pass rates. So we have this very clear document where we describe who's going to be doing what and by when and what we expect to be the outcomes. And again, this is just a portion of some of these proposed actions.
So the timeline and the plan are that we want to track the Commission on Dietetic Registration provides all the programs with the exam passage rate twice a year. And once in December, closing date, and the other one in June closing date. So we will have our next pass rate for the programs, for our DPD program and our internship in January of 2022. And at that point, we hope to see an improvement that we have implemented for the last 6 months. And then we also wanted to survey our internship or supervised practice and didactic program graduates about the experience. And there's been an ongoing survey, but we would like to also continue with that. And the next one is anticipated to be in the summer of 2022. The assessment, of course, is in the didactic program. So we are looking at to see what are some things that we can do within each course of the didactic program to help us to achieve that 80% pass rate on the exam, which means is that we also are setting it with the 80% expectation of the pass rate for the classes on the assignments and the exam. And then what we also are doing is that in order to get a verification statement for the didactic program and for the supervised practice program, students need to complete the requirements. And so we're particularly looking at to see what are some things that we can do within the didactic program verification statement so that we can have the students be held accountable to perform well as they go into internship and then to be better prepared for taking the registration exam. So one of the things that we're looking at is that within part of the assessment plan within the program is at the end of the first year, the student take the formative exam. And then in the second year of the program, they take the summative exam. So we want to maybe use a criteria for issuing of the verification statement to have the students pass a summative exam before they can receive a verification statement, in addition to the B- requirement for the 3,000 and 4,000 level upper division courses, and with the overall GPA of the B-. So lots of criteria that they have to meet before they can get the verification statement. But we want to add one more, that to have the students be accountable to take the summative exam more seriously, is that to possibly use that as a criteria for issuing the verification statement. And then we need to also look at the program courses to assess to see the course material covering our registration exam contents. And so the plan was that we wanted to review the assessment plan for the program and looking at all the classes, the courses within the didactic program, and then also making sure that they are passing, doing their assignments and passing the exams with a B- or better at 80% of or B or better with the 80% pass rate. And then to continue regularly schedule the meetings to track the progress on the action items within the program faculty. And then to incorporate professional review courses for the graduates. Right now, our interns in the ISP program, which is our supervised practice program, they are given a professional review course in the class so that we can incorporate the review material into each of the didactic courses that they take within the internship program. And then we would provide practice exams to the current and former students so that they can practice taking the computerized based exam. And also we need to assess the factors that may contribute to low exam passage rate using some predictive modeling, including the GPA and how they perform in certain courses as well. And then the last thing is that we want to consider changing the criteria for the verification statement to include the passage of that summative assessment test at the 80% rate, which we already have implemented within our supervised practices, that they have to finish the exit exam with 80% prior to receiving the verification statement for the ISP program in order to take the registration exam. So the overall goal of our assessment is that we wanted to collect data for the submission of the interim report on the exam pass rate, which is due in March 2022, and that report need to be submitted to Ascend. And then to continue data collection for the self-study report and site visit with the success of the program pass rate plan and all of that for 2027. And if our exam rates do not improve by March report, they would like to have us submit another interim report in July 2023. So assessment is ongoing, and that for us to hopefully use that data finding from the assessment in order to improve our program and the success of our students.
So on behalf of Dr. Chen and myself, we'd like to thank you for your attention and for viewing our presentation.